concrete. Following will show you how to use these materials to perform professional crack repairs utilizing structural injection techniques. First, clean the crack using a wire brush. Vigorously clean the concrete surface surrounding the crack so the crack is not plugged with debris. Blow out the crack with compressed air. The A and B components from the containers of Miracle Bond. Mix both components until a consistent gray color is attained with no streaks. Apply Miracle Bond over the crack. Press in and smooth with a putty knife, leaving a 1 to 2 inch gap for the T-port installation. A standard rule of thumb is to place the ports 8 to 10 inches apart. Miracle Bond should be applied at least 1 to 2 inches wide along the length of the crack. Using a putty knife, apply Miracle Bond underneath the outer half of the T-port base. Ensure that the T-port passageway is not obstructed or blocked when applying the epoxy. Center the T-port over the crack face in each gap and attach. The port is properly attached when Miracle Bond extrudes out of the relief slots. An optional step is to attach observation windows over the crack in the same manner that a T-port is attached. These may be used as viewpoints during the injection process for examination of the resin flow through the crack. Be sure to leave the center of the observation window clear for viewing. Install one observation window for every 5 T-ports. Be sure that all 6 relief holes in the observation window are filled and sealed with Miracle Bond or leaks will occur. Allow Miracle Bond to cure prior to starting the injection process. This depends on temperature. Cooler temperatures will slow down the cure time. Refer to the cure chart on the Miracle Bond label. Insert CrackProLR321 into a dispensing tool. Remove the cap and end plug. Dispense material into a disposable container until both components are flowing equally. Insert the flow control onto the end of the cartridge. Attach the nozzle. Hold the cartridge upright while dispensing to purge any air bubbles. Dispense 1 stroke of material into a disposable container. Do not use the material in the container. Start at the lowest end of the crack. Insert nozzle directly over the T-port tip. The surgical tube will expand as it fills with resin. Remove the nozzle from the T-port, being sure to grasp the T-port firmly while removing the tubing. This helps to ensure that no damage is done to the epoxy seal encapsulating the T-port. Attach the nozzle to the second T-port and begin injection until the surgical tubing expands and is filled. Stop the process if leaking occurs during any part of the injection procedure. Assess the problem and determine if recapping the crack or resetting the ports is an option. If observation windows were installed, they may be used to view the flow of epoxy being injected during the process. Here, you'll clearly see the epoxy flowing during injection. If no flowing epoxy is visible or it does not appear at the next T-port, it's possible that it may be running out of part of the crack that is not visible. Inspect the T-ports after 5 minutes and note the expansion of the surgical tubing. If none of the surgical tubing is still expanded, more epoxy may need to be injected. A more finished look may be desired if aesthetics are important. Wait at least 12 hours for the injection resin to initially cure until grinding. First, remove the ports using a sharp tool and a hammer. Finish by smoothing out the cap using a grinder.